welcome back Dr. Stein Bronsky, okay, because we hadn't had him for a while, and he was out exploring the universe. And so you're back from outer space, I think, if I remember, Stein, and welcome back to planet Earth. How are you doing? Okay.
Yeah, thanks. It's really good to be back. I missed everybody and looking forward to engaging fully.
Yeah, good. Fantastic. Well, good. And then what's the latest out there in Colorado Springs? Anything to report to us that we should know about? You guys have done really well. You never got hit very hard with COVID, right? So as far as I can tell.
Yeah, no, we have weathered the COVID storm fairly well. I think that the dominating issue out here right now is pre-hospital sedation with a proposed House bill that's going in front of the Judiciary Committee tomorrow for a vote and testimony on pre-hospital sedation. It's a very, very limiting bill. It would not be good for EMS at all. And we are really ramping up on organizing the testimony for tomorrow.
Okay, good. Yeah, we've been talking about that a lot over the last couple of weeks, thanks to contributions from NEMSP and others. And ASAP has been obviously on top of this as well. Especially, we've talked about the issues where they specifically named that they can only limit a number of NAMSP people being on the board and things like that. That legislation is just, strange stuff. But whatever. Yes. But thank you very much for. It's just great to see you. That. So where are you located right now? Is this your home? Because we're seeing
this is my home. Yep.
Yeah, we're looking at the ceiling pretty well, so that's why.
Yeah, this is my office. Yeah.
Oh, great. Looks very nice. Okay.
Yeah.
Then I got to personally visit Jim Augustine's office where he is right now. I know exactly the whole layout there, Jim, and I could see the poolside in the back. It's great, and Jim Augustine is so lucky. He lives amongst the panthers and alligators, and that's fantastic area where he lives in. And got to visit there the other night, and it was really very nice. He's just an incredible gentleman as usual, and just took me in for a little while, and we had a great time. So anyway, so Jim, how'd you survive the weekend? Okay.
I managed to survive, and I'm glad you did too, Paul.
Yeah, me too. Yeah, exactly.
Trip with the alligators.
That was quite a day. So it really was. All right. Hey, so tell me who Jenny Geither is, if I pronounced it right, I hope.
Hey, you got it. I'm the Deputy Medical Director for Baltimore City.
Okay, got it. And so are you forced to work with Ben Laudner then? Is that what you're telling me?
I am, and I have known him since I was in med school and he was the chief resident on emergency medicine. So we go way back.
Okay, good. Well, welcome. Thanks for joining us today. Okay, well, thank you very much. I just like to know who everybody is that's on, that's all. All right, so a few people said they're going to join us later. One person has a little bit of a problem, is Mike Kaufman, in terms of time. So I thought I'd have you jump ahead and do your report now, Mike, that you were going to talk about, as I called it, avoiding trauma, melodrama, and enhancing data system injury care, right? So can you do that for us?
Yeah, Paul, thanks. Can you hear me okay?
Yeah, and for those who don't know, again, welcome back, my friends at the show that never ends. We're with the Eagles, the jurisdictional medical directors for the largest cities in our country and elsewhere. And also, we have Mike on board representing the National Association of EMS officials as a medical director there. And he's the medical director for the state of Indiana. And enough said, take it away.
Cool, thanks, Paul. Okay. Yeah, thanks. If you guys can hear me okay, I apologize. I'm going to have to talk a little bit more quietly today, but I've got just a couple updates for you from the National Association of State EMS Officials. And the first one, and they're actually all fairly big news in the broader scheme of things, but the first one is a policy statement that's due out really imminently. It should be out any day now. And this is a joint NASEMSO, American College of Surgeons Committee on Trauma policy statement, kind of done in conjunction with the NEMSIS Technical Assistance Center. And what we've been working on is creating and this is a policy that speaks to the applicability of a universally unique patient identifier that will be assigned to the EMS record. This unique identifier would be generated when completing an EMS patient care report and then exported to a matched trauma registry record, like when a hospital abstractor or a registrar is completing a trauma registry entry. I think all of you can probably imagine the benefits that this would have in linking data sets from the trauma registry to EMS records. And by having a unique patient identifier, this is going to add a linked data set at the National Trauma Database, as well as the TQIP level. So this is due out any day. I keep checking in daily with DIA for updates, but I think we've all been working towards this in some way or another to have a unique patient identifier. So that's one of the big pieces of news. The other one that I think everybody's going to find some interest in is that NASEMSO is convening a technical expert panel in May to review, to scan and identify and catalog all of the different state EMS office interventions that were put in place during COVID to enhance local EMS operations, resilience, response, everything from state-specific guidance to relaxation of regulatory requirements. This is being done under an agreement with FEMA in order to update the USFA's 2009 publication, Information for First Responders on Maintaining Operational Capabilities During a Pandemic. So if there's anyone interested in getting involved with helping to catalog these efforts across states, you could reach out to Mel House at mel@nasemso.org. So something else that would be interest to this group. A couple other things, and I know it's been a few weeks since I've updated you from NASEMSO, so I've got several here to share. As you know, NASEMSO has also been working on a pre-hospital pain management guide. This would be an evidence-based guide on treatment, evidence-based use of pain medications. This is going to be due to NASEMSO, or excuse me, submitted to NHTSA in May. So just wanted to make everybody aware that this will be appearing in pre-hospital emergency care coming up shortly. But this has been a great effort by a lot of people to try to put together some evidence-based guidelines. Okay, last but not least, and this is just new, this is kind of hot off the press. I think we've all seen and been looking at alternate response team configurations for both behavioral health and substance use disorders. These are emerging really all over the country. And NASEMSO has been asked to shepherd a group of national associations and organizations with expertise in this. So there's an effort now underway to put together this information. I actually have an entire PDF I was hoping to upload to you, and I may have to send that out through Jim or you, Paul, just because I'm not in a position where I can add that to the chat today. But I think this will help everybody kind of get a better handle on the different and alternate team configurations, such as quick response teams and all these different unique teams that are putting together to help respond to behavioral health and substance use disorder crises. So look for more to come on that. On a personal note, I'm super excited that the folks from EMS World Expo are going to be in Indianapolis on Wednesday, checking out the city as a potential host site for EMS World Expo 2025. And I'm looking forward to spending some time with the gang. So that's all I got today, guys. Thanks. I'll try to upload more info.
Okay, anybody have any questions for him before I go on to the next speaker? If
Mike,
not,
send those materials to me, Jim Augustine.
Absolutely, will do. Thanks, guys.
Mike. Hey, now you have an uptick in Indiana lately in terms of cases. What's the latest there?
You know, Paul, we saw a slight little surge, but we've plateaued out, and that is all now coming back down. So we're in really good shape. Still offering mass vax at a FEMA site up in Gary, the Indianapolis Motor Speedway, and several other places throughout the state. So we're at right about 2 million Hoosiers fully vaccinated out of a population of 6.9 million. So we think we're doing pretty well right now.
Excellent. Okay, thank you so much. Hey, Tom Collins, real quickly, is the 216 number you or somebody else that's up there? Just wanted to know just who I'm talking to here.
You are correct.
Okay, good. I wanted to double check. All right, thanks. All right, so meanwhile, morning, Jillian. Everything going okay on your end there at District 7?
Yeah, I'm actually still in El Paso,
Okay.
working with the vaccination mission. Everything's going well.
Okay, great. Do you have a good saloon there in the background? It looks like it. That's good. It's all you really need out there, I guess, after a long day's work. Okay. And then tell me who Tom H is that just called in. Just anybody can tell me which Tom that is? Looks like someone Tom H is calling in, so I just want to know who that is. Obviously, they don't know who they are. So, all right. If that's something you could find out in the deep background, Julian, I'd appreciate it. Okay, got it. Hey, all right, so let's move on. And then how's everybody doing over there? Is David doing well as well? He's on there. Is he in District 7? David, are you there?
Yes, sir. I'm doing well. Thank you.
Okay, good. We just want to thank you guys again for hosting this and all the great stuff you're doing. And Julian, I think you're getting squared away on the other issue we talked about earlier this week. Okay, so thanks a lot. That's great. All right, so let's go on, which kind of reminds me, for those of you, if you haven't made hotel rooms, I keep getting people calling me to get hotel rooms, and it's getting close to the point where they may not have them available. So please do let me know or fill out that form for us to make sure you got you plugged in. I don't want to have to put you in a position where you have to go somewhere else because the prices are really high otherwise. It's like the difference, we're getting like, I think a $179 plus a $10 resort fee. And it's like something like $450 or something ridiculous like that if it's outside our block. That's why I just want to make sure everybody knows that. Okay, but it sounds like every day there's more and more people coming. So we got quite a quorum coming. So I'm looking forward to that. And that's only about a month and a half away, which is really amazing if you think about it. All righty. So as Jim Augustine just put up, our CME code for today is 12966. 12966, and it was 12967 for the ones that were on the Seagulls call, our earlier Florida call. So 12966 for this Eagles meeting. So thanks a lot. Let's move on. Hey, if you don't mind, I'd like to swing over to Mike Sayer there from Seattle. We haven't had him on for a little while, so I just wanted to get if you don't mind me blindsiding you there, Mike, and calling you up and seeing what's going on in your neck of the woods that I have to do. Okay.
Thanks, Paul. I'm driving to work. So for us, we're definitely experiencing an uptick in cases in Seattle and King County. And meanwhile, we're continuing to vaccinate. I think this week we're switching from a mode where we've been like having a lot of demand more than supply to where we have more supply than demand of vaccine. So this is interesting. And we're trying to brainstorm ways to use our EMS workforce to help go to where people are. So I think we're going to try doing some pop-up tents and like places where young people gather to have beverages in the evening, or maybe baseball games and the like, and see if we can capture.
And Mike, if I can interrupt you a second, other we swing over to Meg Marino, you're on with Emily. Tell us what's happening in New Orleans regarding that. Then I'll go back to Mike. Hey, Meg, are you there? If not, Emily?
I am here, yeah. So things are going great. They've been.
Oh no, I just want you to talk about. He's talking about how they're serving to young people in places like baseball stadiums and other places where they gather. Tell us about what's happening in New Orleans in that regard. That's all I wanted to know.
In New Orleans, we're doing shots for shots. Our local health department has decided to bring the vaccines to the people, which has been really, really, I think, ingenious. So they are having vaccination nights at our local bars. And if you get a vaccine, you get a free shot at the bar.
Yeah, so we'll come back to New Orleans, but I want Mike to hear that because they've been doing it in the Big Easy, as they say. So back to you, Mike.
Yeah, well, we were aware of that, but unfortunately, under Washington liquor law, we're not allowed to give away free alcohol. So we did have this explicit conversation yesterday about the Shots for Shots program, and so that won't work for us. But maybe we could give them some garlic fries or something,
I love it. That's really great. So that's good. So,
hey, Paul.
Yes.
So this is Jeff down here in Texas, and I'm a little worried about the Shots for Shots, about how that might be implemented in Texas.
Yes, exactly.
We might just insist on giving people firearms, and thus causing another problem.
I know, it's funny. That's great. I'm sorry to have done that to you, Michael, Sarah, but go ahead. Anything else going on besides that?
No. And, I appreciate Jarvis's commentary there. So yeah, there could be some people that would misinterpret that.
All right, so I'll keep my eye on the garlic fries approach. Sounds good.
Hey, Mike, could I ask one quick question, Paul, if you don't mind?
No.
Yeah.
Mike, how have your paramedics done as far as getting shots? What kind of percentage of your folks have gotten immunized?
Yeah, I don't know the actual answer to that because we haven't forced them to tell us. My sense is it's roughly 75% are vaccinated, but I don't have proof of that. We did have our first outbreak at a fire station about 10 days ago since January. And it was a vaccinated person who came to work and was having symptoms and was fully vaccinated and had disease that he caught from his spouse. And then he may have transmitted it to a couple other people. I'm still waiting for the viral sequencing to come back to kind of say for sure whether that happened or not.
Thanks. I'm just looking for any way to improve Nashville. We're at like 52%. And when I bring it up, it's like I'm saying, maybe you want to sacrifice your firstborn kid.
Yeah, right. So anyways, it's still that what we're hearing from you two is that's what seems to be prevalent around the world. So there's just this holdout. So anyways, there's been a couple things we've tried, but I can't talk about it here on the air here. So, it's, what can I say? All right. And so, Mike, thanks a lot for the report from Seattle, and everything else is going okay there in the city. How are they doing in terms of opening things up again? Are they being aggressive about it, cautious about it?
I think it's still a little cautious, and with the increasing cases, I don't see us opening up further, but people are definitely out and about. I think largely the idea that people are just going to stay home and wait for this to be over is not how the public is behaving anymore. Traffic is the best clue of that, and there is traffic again.
Yeah, right. Yeah, it's been fascinating to see how that's picked up. One place that hasn't entirely picked up, beginning to, is New York City. What's happening over there? Glenn, what's the latest in the city? Are you opening up things more and you're seeing more traffic? Because people used to use that as an excuse, and they couldn't use it the past year that they were late because of traffic.
Yeah, New York City is, the mayor has said that all city employees are supposed to come back to work May 3rd on a limited availability. So everyone's preparing for that. Here at headquarters, for example, they put one-way signs in the hallways. And I just actually can't get from my main office to the other section without getting myself dizzy. I'm trying to figure out the damn sign. But
seriously, there's like one-way traffic? Is that how it works?
One-way signs, absolutely. They have this way only. And then we figured out that to get to actually my office here in the corner of the building, you physically can't. So that's great for me. There are going to be fewer people visiting me, but we can't figure it out. I've been practicing because people haven't been back yet, but that puts me in a circle sometimes.
Well, at least there's no cross-town traffic.
There you go. So, our vaccination, the fire department, both the
before you go to that, Glenn, tell me how your two people are doing that got ill. Okay.
Yeah, they finished, two of my physicians, post-vaccination, they tested positive, very minimal symptoms, luckily, but they were quarantined for the 14 days. They were working from home. They were able to do that. So they're back working. So they're doing well.
And not so ill. Okay, good. Okay, go ahead then, Glenn. I'm sorry to have interrupted you. Okay.
Right. So both the EMS and fire side at FDNY, about 50%. We just trickled over to about 50% now of our members who have received the vaccination. The shots for shots, can't do that here either, I don't think, but we're actually getting more shots, unfortunately, the gunshot wounds. We had 400 over the last week. I'm sorry, not 400. We've had 20 over the last weekend, and we're 250% above what we were even last year when we had So that's still ongoing. And I think so far for the year, we've had 416 shootings, of which there are like 350 victims or something like that. So it's been pretty crazy.
Yeah. Okay. That's really fascinating. Well, it's great to see you're doing okay. Hope everybody's doing okay at home, as we've talked about before. So good to see you. So, all right. Someone would like to plug into here real quickly let's see who it is. Trying to see who there was. Oh, Fiona. I'm sorry, Fiona Moore, since she's over there in a little later hour today, over in the UK. Anything new to report for us, Fiona?
Yeah, good afternoon, Paul, and hi, everyone. So we're continuing vaccinations in the UK. We've done over 95% of the over 60s, and we're now hitting the 45-year-olds. And thanks to all the information that came out of the US, we're now offering vaccines to the pregnant ladies.
Yeah.
The cases in the UK are continuing to go down. Lockdown is easing, so you can now meet up to 6 people outside. Pubs and restaurants, you can go there but eat your food and drink outside. Gyms and hairdressers have reopened. I think one of the worrying things that we're seeing is the number of people in quarantine hotels. So we've now got over 1,000 people in quarantine hotels. So these people who've come back to the UK from the red list areas. And that's presumably going to have a number of the variants of concern. And we're also pretty worried about what's happening in India. So we've sent shipments of ventilators and oxygen concentrators, but there's a drop in the ocean compared to the requirements that they've got. And that's about it from me. Thanks, Paul.
Yeah, I just got off the phone with my friends over in India, and it's just awful, awful. I mean, there's bodies piling up literally, and and then people, they think they're lucky to get a hospital bed, then there's no equipment and so on. They're really overwhelmed. It's going to be disastrous for them, or it already is, I should say, but even more so, and it's escalating. So thank you for that report. And we're doing what we can, I think, here in the U.S. to try to get more equipment over there, and that's why I've been talking to the Commerce Department people. So they've been really instrumental in this. So, all right, let's move on. And hey, Angus, and anything to report on today from, I'm just gonna go in some reverse order here a little bit, from your neck of the woods in Tampa Bay, et cetera?
No, we're about status quo, still struggling to get folks vaccinated. Demand is really tanked. Our Board of County Commissioners is deciding whether or not to end the mask mandate here in the next week or two. So that's probably not going to help us either. We had a great presentation on finger thoracostomy on the Florida session earlier today.
And Corey, that was done by Jeremy, just so you know, because we've all worked in that area together. So just he did a great job on that. So I think you're familiar with that work. So it was kind of nice that we had that. And by the way, for those who are on from the Florida contingency again, that was 12967 for your CME code, 12967. Okay. So anyway, so do you get to interact with Jeremy much still, Corey? Oh, I don't know if we lost Corey there for a second. So
he's back.
Yeah.
Corey. Yeah, Jeremy's great. Just a great guy.
Yeah. So he
incorrigible is probably the word I would use.
See, he didn't have a clue who I was, because that was where I had the War and Peas name up, right? He was calling me Dr. Peas. It was funny.
I'm going to see him at conference. I will let him know.
Tell him that they said, I heard you were on the phone with the world famous War and Peas. That's great. Okay, thanks. Do that.
I'll take care.
All right. All right, let's move around to a couple of places I'd like to catch up on. Jeff Jarvis, since you did pipe in before, I'd like to hear a little bit more. You're down in Williamson County, near Austin, et cetera, and down in South Texas. Tell us a little bit what you're seeing out in more of the suburban and non-urban areas.
Well, keep in mind, this is Texas, and COVID no longer exists in Texas.
That's right. I forgot. Okay.
The edict has gone out. We are seeing our cases are continuing to drop off, but not precipitously. They're really kind of hanging where they have been. Immunizations, we have more vaccine than we have arms that are willing to get vaccinated. Yeah. From a county effort, we're stopping our mass vaccinations. We think that the supply is sufficient in pharmacies and clinics. So we're just moving the numbers we had over to private places and stopping our mass vax. And I think that's about it.
Okay, good. And Jeff, to answer your question, because I know you want to come for the 4 days at the Eagles, I don't see your name that was on the list. This is an older list. So okay. Definitely, if you can find that thing, or I'll try to call, but you wanted all 4 nights, Monday, Tuesday, Wednesday, Thursday. I'll try to call Anna that handles that and let her know. I have a couple other people who were in the same boat, I think. So it's going to make sure.
Appreciate it.
It would help if you did it, because then it populates automatically for her. So that helps. Okay.
You bet. I'll take a look.
All right, great. All right. So, hey, Josh Hartman, I was going to try to call you last week. I lost you there for a second. Can you tell us a little bit about what's happening in your end of the world, EMS world? Okay.
Yeah, absolutely. Thanks, Paul. So we are very much in planning mode for the expo this fall, October 4th through 8th in Atlanta. We did a site visit there this past week where all systems are a go. We are obviously, taking the precautions, which, yes, there are less in Texas, but Georgia doesn't have too many either at the moment. And we're working through Grady as well. So yeah, we're planning an in-person event. We will be streaming the 4 larger of the tracks that we have going on simultaneously will be available online, both live and then on demand. But so far so good. We are all systems go for Atlanta in October.
How was Lectureship to work with? Did you get to work with her much?
Amazing. We sat together. I think it was last Thursday. She left with a list of things to do, and I don't think she got up from her seat till she sent all those emails out.
Yeah.
She's been amazing. Yep.
Okay, good. Yeah, so it's so that's fun. Yeah, we had a good talk. She's going to be heading down here to Florida, so I'm really excited to see her because this will be a first time. A lot of people actually, this will be their first time meeting with us, so I don't think they know how cool it is, when we all get together. So it's great. All right, well, thank you very much.
Sure.
I saw Roberto Fumagalli from Milano on, since we probably need to get him on as well. So Roberto, what's going on with in Italy now, and particularly up in the north? Can you hear me?
Hi, Paul. Hi to everybody.
Yes, hello.
Hello. Here in Italy, the situation is, let's say, it's improving. The number of hospital admission and emergency call for respiratory failure due to COVID is progressively decreasing. And actually in Lombardy, we have something like 500 patients inside the ICU, COVID patient inside the ICU. And at the top, we reached the number of 867. So it's decreasing. Comparing the decrease with the previous waves, let's say that the decrease in the occupation of hospital bed is a little bit slower, but is going down. We actually have to see what it will come up when as I think you know from yesterday, we just changed our attitude. So the lockdown was, let's say, modified very much. So people are attending to the schools, and many activities are now on. So we will see in the next couple of weeks what it will happen.
Yeah. Okay, good. It's interesting because I've been talking to many people about that really great paper you did last year about how you handled the surge. Again, when you got all those calls from the worried well right after February 21st, when you had your first case. And because we saw the same thing, we had to take similar actions in Texas, for example, during the ice storm, and we predict this will be something we'll need to do. So thanks for taking a lead on that as usual. And thanks for your report. Anybody have any questions for Dr. Fumagalli? Oh, one more, Professor. Now, how's the vaccination going in the country, across the country?
Let's say that we reach something like 15 million vaccination. Now the number, let's say in Lombardy, is progressively increasing, and we reach for Lombardy something like 100,000 vaccination per day. It means that we should reach all over the country something, the magic number of 500,000 in order to be able to have most of the people vaccinated in summer. Let's say that we are over with the people over 70 years old, and during this week we will start in vaccinate people 60 years old.
Okay. So overall, just so everybody knows that the country of Italy, the entire country, is about what is it now, about 66 million or something like that? Is that right? Yeah.
65.
Yeah. Okay, that's close enough. So so that or maybe it will be 65 million by the time we're finished. The way this is going, it was terrible. But I'm glad you're getting better control over things. So thank you so much. That was a good report. It's really great to see you. May I ask where you are right now? Are you at home, or where are you? Oh, sorry.
I'm at work. I'm at work.
You're at work. Okay, got it. Okay, got it. Because I couldn't see where with the background there was a thing. So that's great to see you there. Okay, good. I'm glad that, and I hope everyone is well in your family as well, right? And okay. Have any of your people gotten sick? Let's say your faculty, staff. How did they get sick over this past year?
Basically, we inside our hospital, in the Department of Anesthesia and Intensive Care, we had out of 120 anesthesiologists, we admitted to the ICU one person, and he did well. He did well.
I'm glad to hear that then. All right, fantastic. Were you guys using the helmet CPAP at all? Like the thing that, Massimo has always advocated?
Yeah, basically we are really very fond of the helmet. I think that we, in our school in Milan, we had been, I think, among the first who used the helmet. And let's say in the hospitals, we had more than 100 patients treated with the helmet at the same time.
Right.
So we used a lot.
That's
in
amazing.
the world,
Yeah.
in the world, it was the high flow, and the helmet was the most frequently used device.
Fantastic. Well, that's great. We had Massimo on, Dr. Antonelli was on early in these sessions and did a nice explanation for us. So it's interesting to hear that. So that's good. Very positive. Okay. Excellent. All right. So how's my Italian? Excellento, right? All right. Thanks. Okay. Buonasera. Let me switch over now to, I'm going to go to Hollywood. Hey, Hollywood, Randy Katz, if you don't mind, we haven't talked to you for a little bit, and Randy's done some great stuff, turned me on to a lot of things like the platelet mapping last year, which has turned out to be very important. And so Randy, what's going on in your area?
Yeah, I mean, I've been really getting hit pretty hard at the hospital. Our hospitals have been busy. We've seen our COVID numbers actually turn upwards for the past 3 or 4 weeks. We've seemed to have plateaued at this point, but overall, hospital volume and demand, both EMS and ER have picked up down here. As everybody knows, South Florida has been pretty much open since March of 2020. So it's really been a free for all down here. And I think we're at a plateau at this point. Vaccination demand, as Angus mentioned, is really tanked. We've seen in Palm Beach County and some other counties, they've shut down their mass vaccination sites because demand has dried up, and some places are operating at 50% capacity, and we have an oversupply of vaccine at this point. And I agree with Paul, getting a lot of these vaccines out to the rest of other countries, outside of the United States is, I think, really important at this point for us, globally. It's been busy. I'm looking forward to having everybody here in Hollywood in another month and a half. It'll be nice to see faces and, get our heads together and share information again. So I'm looking forward to that. And otherwise, things are pretty stable for the most part.
Okay, good. I'm trying to think if there was anything else I'd say. And by the way, thanks again, in case anybody just know it, Randy, he and Mike Estreicher there were the ones that first turned me on to the concept of doing the tag with platelet mapping, which turned out to be fantastic. And I think it's made a difference. It ended up being one of the most emailed papers amongst critical care doctors, I think back in January and February. So thanks for the great contributions as usual, Randy. I appreciate it. And so have you been over and done any site visits of the hotel itself? Because I know you guys are kind of the hotel of choice, or hospital of choice for the hotel, right?
Yeah, I haven't been there recently, but it's a great venue. I think everybody will be very pleased there. It's just a large open lecture center, and there's just so much to do there. And I think after hours there's plenty of fun times to be had at night as well. So
you got some good plans coming up for it, so for the after hours, so which is great. Okay, good. Well, thanks, and thanks again for being our host system there in Hollywood, and thanks a lot for everything you do. All right, let's move on. Hey, Reverend Crow, I haven't talked to you for a while. What's going on there with ESO, or even with you? What's going on there?
Oh, well, we are staying busy here. I've been building the 2020 research data set, and that is going to be released later this week. So that's for public use. Anyone can request it. And I've been knee deep in ketamine data, as you might suspect.
Yeah. Yeah. So how you're just knee deep? Thank God, it's not up past your thighs or anything.
Not yet.
Not yet. Okay, got it. All right. So is that going okay though, as far as you can tell, or is it just a lot of work?
Yeah, no, we're just preparing, some bullet points to have ready and to make available to those who are going to be doing the testimony in Colorado.
All right. Yes. Okay, good. Well, thank you then for your help there. So that's a nice pivot over to Sandy Schneider, who has been involved in that to some extent. So if you don't mind, Sandy, what's going on there?
Yeah, so we are following the Colorado bill carefully and working with NAMSP. Mike has been doing an outstanding job, and a major shout out to him. The ketamine paper continues to linger in almost ready form. So hopefully that will be done. I did want to mention to you all that we are having a special COVID research forum August 4th. The abstracts are due May 21st, I believe. You can find that on, if you go to the ACEP 21 site, there's two buttons, one that says research forum, special COVID research forum, and the second says regular research forum. I wanted to mention that papers that are in the COVID research forum will also be part of the ACEP 21, but this is a chance to get your abstracts out early. So I think that's important. I'll try to put the link in the chat once I get off. The other thing that you guys have already alluded to, as you know, we have this data visualization project that we have been doing with the CDC. ED visits are up everywhere dramatically in the last 2 to 3 weeks.
Wow.
You can go, I'll put that in the chat as well. You can go to the graph and see those numbers. Anecdotally, it appears the trauma season has hit in the South, but the numbers are up 25, 30, 35% over last year this time. Again, that was the nadir, but looking at 2 years ago, the numbers are almost tracking exactly. So it's strange. It looks like we're back all over the country. And that is, by the way, not regional. Every place is up. And then the other thing I wanted to mention, like the meeting I heard before in October, ACEP 21 will be in Boston this year. We're planning a major party. And so I hope that you guys can get to at least some of it. It will be hybrid, so the people who can't get there will be live streaming and the usual stuff that we're now becoming very, very used to. But the meeting will be there, and it will be a major party for us all. One last thing, back to the volumes being up. The other thing that seems to be up is boarding. And boarding is now hitting all-time highs, primarily because they've let a lot of nurses go. And now they need the nurses in the hospital and they don't have them. Not so much in the ED, but on the floors. So the ICUs were full, the floors were not so. Always something wonderful. And again, I'll put the links in the chat regarding where you can get the data and also where you can get the information about the COVID research forum. Any questions?
No, not off the top of my head. So it's great to see you. So we'll be happening. You won't be in our CDC call today, but I'm anxious to see where they are on several things this afternoon, especially if they talk about the masking issue. So we'll see if that'll be out yet. All right. And by the way, thanks for plugging us in with them, because I think it's been helpful actually more for them, because we're feeding a lot of information to them. That's been very useful. So you did a great job of this being the facilitator in chief as usual, Sandy. So, all right.
And they did mention the thing around N95 masks, and we have a poll going on our research, on our COVID forum rather, looking at how long people are using it. And we're hoping, according to the CDC and the American Hospital Association, mask availability is back to normal. And it should be that people can use, they're saying that standard use would be keeping the same mask on until you doff it for whatever reason, either after a patient or you need to take a drink of something or you want to talk, but you should not be reusing masks. We don't think that's what's happening out there, but that's what they say.
Yeah. Okay. And by the way, I did talk to Michelle Byers. Sounds like we're doing some, some collaborative stuff. So it's really good, including the looking at supporting theater of war, et cetera, as we do that for the upcoming meeting in June here. All right. And then it sounds like some of our friends from Theater of War, their movie did really well this year, with No Man's Land, that kind of thing. So which is kind of neat. All right, so let's see. Let's go ahead and go to Crawford in Philadelphia, if you don't mind. We're up in that, as I'm just looking at his name right here in front of me. And then maybe Chuck, I'll go to you next. Okay, Crawford, anything new to report from Philadelphia? Anything you're working on right now?
Not really. I was interested in the Sandy's comment about diversions, boarding, stuff like that. That's been a huge issue for us in Philadelphia in the past couple of weeks, where at any given time during the week, the majority of our hospitals can be on divert. And once again, I think the hospitals are filled to the rafters. Boarding the emergency departments is becoming an increasing issue for us. And I think that's sort of the biggest of many big issues at this point.
But there are there are fewer cases associated with COVID, right? But
Yes.
It just all the other stuff is popping up. So
It's
that
just
goes
all the other stuff.
Yes. Okay. Got it. Yeah. Hello. Hang on. Hey, hang on for a second. Yeah. Can you guys? Let's see. I'm trying to think who else I want to go. Oh, Ken, can you give the presentation you wanted to do briefly for us about? I can't remember what. Oh, you're going to talk about the treating the coagulopathy. Can you do that? Ken, are you there? Ken Shepke? Hey, Ken. Well, he may be on call. I just wanted to sort of, because it would be a nice little presentation for him to give at this point in time. But since he's not there, let's turn it over. Ken, can you get there? If not,
Yep,
John.
yeah, I'm there. Sorry.
Did you want to give us?
Just having it was double muted.
Yeah,
Yeah, absolutely. Let me just pull it up real quick.
That's good, and I can sign off for a second.
So-
Okay, thanks. Okay.
Yeah, you got it. So I'm just gonna share my screen real quick here, guys. And so what we've got going on here is basically an autoimmune thing, very, very similar to heparin-induced thrombocytopenia. By the way, can you guys see the screen okay?
Yes, sir, you're good to
You
go.
can see it because I can't. Great, fantastic. So it really stresses the importance of VAERS because that's how this was picked up. We saw 7 cases of thrombocytopenia and 10 of thrombosis in VAERS under the Johnson & Johnson vaccine. And actually, it has, we were worried about the overall vaccine hesitancy, but it's actually dropped. It's gotten better since January, despite Johnson & Johnson, but people are now afraid of getting Johnson & Johnson, with only 22% saying they'd be willing to get the Johnson & Johnson. But that overall, it doesn't look like it's changed their willingness to actually get the vaccine itself. So this is not a spike protein thing. I know there was a lot of question on that. This seems to be related to the adenovirus vector itself. We've seen this with other adenovirus vaccines in the past, especially in animal models. It's occurred with AstraZeneca. This is an autoimmune antibody to the platelet factor 4, which causes platelet aggregation, cross-linking of what we call FC receptors. If you remember from biochem, FC receptors is the place where the base of the antibody attaches to a cell, and that actually causes the platelets to activate. This occurs in women primarily, especially under the age of 60, especially 18 to 49 for the Johnson & Johnson group, at a rate of roughly 7 cases per million doses. And since it's an antibody-mediated thing, it's not something that occurs immediately. It starts when you start making antibodies to the vaccine, which that's why we're seeing the cases between 5 and 14 days afterwards. The way to screen for this is you obviously look for signs and symptoms of blood clots, especially in the cerebral sinuses or in the splanchnic, and then get check their platelet level. If it's low, then you should follow that up with an ELISA anti-platelet factor 4 antibody test. Now, the treatment is IVIG or direct oral acting anticoagulants, and very importantly, we do not see this autoimmune anti-PS4 antibody thing in messenger RNA vaccines. And to be clear, we get almost the exact pathophysiology with heparin. So this is a well-known phenomenon. And just to go over why IVIG, this is like a little cartoon. I know you guys love when I show these little cartoons. So these are the FC receptors on platelets. So they're on a lot of cells, but they're on platelets right here. And this is an example of the heparin-induced thrombocytopenia, but the anti-PF4 works the same way. You get these antibodies that attach to these PF4s. The base of the antibody attaches to the Fc receptor, and that activates the platelets. And as part of the activation, the platelets release things that cause clots, and they release things that causes more PF4 to form, and it also causes PF4 to be expressed in the membranes of the platelets, which causes more antibodies. And now you start getting this cross-linking of platelets and antibodies, and you get these clumping, and the clumping causes the platelets to drop out of circulation, so you get thrombocytopenia, and then of course you get the clots. This is why intravenous immunoglobulin therapy works, because you basically fill the body with all these antibodies, which all have their own Fc receptors, but they're not attacking the PF4. So you basically park all these benign antibodies in all the Fc receptors, so this cross-linking of the Fc receptors can't happen. That immediately shuts off the entire process. And just like homeostasis, tries to bring everything back to neutral, your body senses that you got this overwhelming amount of immunoglobulins, so it tends to be immunosuppressive and turns off the creation of more antibodies, because obviously whenever the pendulum swings one way or the other, the body fights to bring it back to neutral. So when you add lots of antibodies, it shuts down all antibody production, and it's immunosuppressive effect, suppressive effect. So that's basically what's going on. And again, obviously, these folks that this happens in, and these 18 to 49-year-olds, the risk of COVID is really low. So when you look at risk-benefit analysis of giving a vaccine, it's not like the 80-year-olds where 1 out of 5 might die from COVID. Very few of these folks, and of course, the percentages are probably even lower than this, because this is for cases where we have proven they've got COVID. And we know there may be at least 5 times as many undetected COVID cases as detected cases. And again, the last thing I wanted to show was this, which is this is not brand new. This goes back from 1999. Intravenous administration of recombinant adenovirus causes thrombocytopenia, in rabbits, and we've seen this in non-human primates as well. So this is a phenomenon we've seen before, and the treatment, IVIG, steroids maybe to turn off the immune system, and that's it. Back to you, Paul.
No, thanks a lot. That was great. Anybody have any questions for him? As usual, it's another great whirlwind and just a great little input. Again, Ken did a fantastic job. Anybody have any comments for him or questions for him? That's great. Where are you up in Tallahassee now? Okay, got it. So next question I have for you is, John, can you react to that or give me any comments?
Paul, Ken is absolutely correct. I'll put it in the chat. Within the ID circles, the adenovirus infection has nothing to do with the vaccine. It's been well shown in both human and animal models. Human experiences to cause idiopathic thrombocytopenia here as well. It's a rare phenomenon, but well described in the late 90s and early 2005, 2006. I'll put a couple of articles in. We've been the ID circle has known about it for a while. I'm actually a little bit surprised that they were not looking for it with the adenovirus vector. That is sort of why, if you look at the Sputnik vaccine, they have 2 variations of the adenovirus, adenovirus 26 and 5, I think. So they don't have the same strain. They were worried about the cross-immune reaction. And I think the American Society of Hematology has put out a very good guidance on how to handle these patients, as well as the treatment thereof. Agree completely with Ken. He's right, as usual, right on the money.
Okay, good. Right on the money. Okay, cool. Sounds great then. Thank you very much then, John. Hey, John, anything else we need to know about?
Yeah, Paul, if I'm on the money, I haven't seen it, so maybe John can tell me where the money.
You're in Florida, Ken. You're supposed to be the other way around here as well. From Portland, we are seeing what Mike up in Seattle is seeing, the same thing. We're in our 4th wave. Our patients, we're at probably a peak of our COVID right now. There's 3 things we're noticing. Number 1, that the patients, as everybody else is seeing, are younger. Number 2, our ICUs are not being stressed. Number 3, there is a geographical differences within our community of vaccine acceptance. Within our Willamette Valley, very high vaccine acceptance, but the more southern and more rural you get, it's sort of dived as well. We're having really no problems. Within our fire service, this is to what Corey was actually commenting on. I sort of commented on this before. Our uptake in Portland fire is around 85%, and Gresham fire, which is East County, more rural, is around 65 to 70%. Our AMR transport is 92% as far as vaccination rate as well. We can go offline, Corey, for some of the tactics we use.
Okay, anybody else have any comments to add to that discussion? If not, I'll start moving around the country. Let's start over a little west of you. There is Libby. Are you still on, Libby Char? I saw you before.
Good
Hey,
morning.
Libby. Yeah, how's life in the world of health directors of states?
I was just texting Crawford. It's pretty awful. Probably one of the worst jobs I ever had, but 83 weeks to go. So we'll get there.
Okay, got it. 83 weeks to go. Near 83 weeks. That's great. How much is that in hours? We'll have to calculate it, right? All right. All right. So, and what is happening in Hawaii? Are you getting tourists back, and are things changing?
Oh my gosh, we're getting bombarded with tourists. One of the big things we're talking about now has to do with like a vaccine passport kind of thing. We can validate more or less for those that got vaccinated within the state, but not from CONUS. So that's the trick right now, is trying to figure out some way to validate that people have actually been vaccinated. And then we can use that as a sort of a vaccine passport, and you won't have to do the test, PCR test 3 days prior to coming.
Yeah.
So we'll see how that goes, but that's a big deal. The other real big deal for us is that legislature is wrapping up, and we just had a bill we've been working on it for a couple of years now, but to take City and County of Honolulu EMS and split it out of our statewide EMS system and give them some autonomy. So that the details remain, but that looks like it's going to happen. And that's a really, really big deal, because we've always had a statewide EMS system.
Okay, got it. So, and then how do you feel about that?
I think it's a good thing. I think it'll be a really good opportunity for the City and County of Honolulu. They're, serving over 1 million people. It's a good size. We got 21 ALS ambulances.
Yeah.
So just looking at reconfiguring and stuff, but I think it's a good opportunity.
And will lifeguards fall under that as well?
Yeah, lifeguards are in the same department.
Yeah. Okay, got it. Okay, cool. All righty. So let's see. All right. Well, thanks a lot. It's great to see you. Good to hear what you have to say. Okay.
Did Libby share with us whether she got her final approval from the state?
Yeah, she did, right, Libby? That's why she's in it for another.
I did. It's whether fortunately or not, but yes, I did. So thank you for those that helped to write me letters of support and whatnot.
That's wonderful news. Congratulations. I know 83 weeks is a long time. You'll do a great job and move them forward for years.
Yeah, it's maybe, can you get out on parole early on?
I'm thinking maybe if I firebomb the place, they might let me out early. We'll see. It honestly, it's like, we always hear about politics and stuff, but it's amazing. It's like dealing with the legislature and some of this stuff is like dealing with the mob. Well, at least what I imagine it would be like to deal with the mob.
And it's really ramped up during the COVID thing in the last 4 years of administration in Washington. So yeah, I can't imagine what it'd be like out there. Good for you, he said ever so sarcastically.
Yeah.
Congrats and sorry. Yeah.
Yeah, seriously.
Hey, okay, so let's, Jim, while I got you on there, do you mind, you have any reports to give us either from IAFC or IAFF or anyone else or anything else you present? Okay.
There was a question about how many influenza deaths there are a year in the fire service compared to the 120 or so confirmed IAFC fire EMS personnel that have died from COVID.
Yeah.
If anybody has any specific information, I don't have it, and typically occupation isn't a breakout factor for influenza, but someone is interested in that topic. The big topic for fire now is the wildland problems that are just set to explode in the West, and how we are going to manage wildland issues. Can we take the masks down, et cetera, in the camps, and preparing the entire country really for what may be required for a response there. Obviously, our civil unrest is still an issue, and then prep for hurricane season, which some of our members are already doing.
Yeah.
Those are big issues now for the fire service. They're planning their first big meetings in August. I'm sorry, in July will be FRI in Charlotte, and then preparing for fall meetings. Thanks, Paul.
It was just really funny. I'm going to share my screen for a second because when you brought up the issue about the flu season, you know, Eileen Marty, who's usually on with us, and I think there was some technical problem where she couldn't get on before all that. But I just saw this on the news the other day. Let me see if I can play it. Can you hear this right now?
When we take a step back from COVID, you may notice there's been hardly any talk about people getting the flu. All new tonight, CBS 4's Keith Jones has the reasons why.
I think I'll continue to wear the mask.
And health experts would applaud his vigilance. He's been intimately affected by the virus. But his vigilance and all of our vigilance has been instrumental in dealing with another virus, the flu. Have you noticed it hasn't been an issue for the last 2 flu seasons? Infectious disease expert Dr. Eileen Marty from FIU says there's a reason for that.
Because of what we've done to try and control COVID, that has led to a huge reduction in influenza worldwide.
According to the Centers for Disease Control websites, 2 years ago, there were 35 million flu cases, 490,000 hospitalizations, and 34,000 flu-related deaths. Now look at it. The CDC tracking map shows all green, low or no flu cases nationwide. Of the 382,000 flu tests so far, there's only been 218 confirmed cases nationwide. In fact, there's been 1 pediatric death nationwide this flu season.
So just the distance alone helps tremendously in reducing the spread of influenza. The lack of shaking hands. Shaking hands has always been a wonderful way to transmit influenza.
Unknowingly, masks, social distance, washing hands, and staying home has crushed the flu season to something we haven't seen in decades.
What we've learned about working from home and other mechanisms of conducting businesses that we should absolutely take to the future.
In the state of Florida, the reduction of flu cases has been exponential. According to the Florida Department of Health, the entire state is green, which indicates super low numbers. In fact, there are 1 to 2 flu cases in just 4 counties.
There's no question. It's down, low prevalence across the board.
Dr. Evan Boyer, Director of Emergency Services at Broward Health, has treated fewer patients for the flu this season. He still encourages his patients to get that flu shot and mitigate exposure by following COVID protocol.
Whether that's, how we educate our patients as far as, when they should or shouldn't seek help, when they should implement a telehealth visit versus a real-time visit.
Both Doctors Boyer and Marty believe that we're going to see a spike in influenza next season. That's because kids are going back to school and adults are headed back to work. But it's how we conduct ourselves that will make all the difference in the world. Wash your hands, social distancing, short of having to wear masks, how we conduct ourselves will make all the difference in how severe the influenza season is next year. At Broward Health in Fort Lauderdale, Keith Jones, CBS 4 News tonight.
All right, let me get this out of here. So in case anybody didn't know, we had a, what's the word, what they call a pink moon here last night. And if I can find this thing, if I can make it work by all my photos here. And might as well show it to you since I have my pictures up, but this is kind of what it looked like outside my place last night. There you go. It was pretty cool. Yeah, coming up. Really good stuff. So let's get out of that. Eileen was in clinic and running late. I was gonna try to have her on, but I thought I'd show that. So I hope that answers your question a little bit, Jim, and I can maybe send that off to you about the flu cases, right?
Yes, thank you.
Could you hear that okay, by the way?
It came across perfect.
Okay, good.
Paul, I have a quick comment.
Yes, please, Doctor, what's your name again? Antevi, is that right? Okay.
Warren Peace.
Yeah, I thought you were April P-H-U-L-E-S, fools. All right, go ahead, Peter.
Yeah, so when this all started, I remember Mike Osterholm mentioned that that the flu in the Southern Hemisphere was extremely low. And I think we had this conversation, and when we were talking about perhaps it was because of all the masking, he was saying that he didn't think it was because of all the masking, because he says people down there weren't masking at the time. So yeah. I'm just curious as to, I know this sounds like a good theory, but I'm just curious, is this is this the is this theory something that's actually been proven, or is it just that this other virus came in and somehow or another got, you know, kind of squashed out the flu? I mean, I'm sure that the hand washing and stuff really made a difference, but you know, the folks in China and Japan, they always use masks and so forth, and they don't shake anyone's hand. So why aren't, you know, so I'm just throwing that out there.
So
Peter, part of this is really that the virus never came out of Asia last fall. So it never made it to the Southern Hemisphere, never made it back to the Northern Hemisphere. So primary transmission from the site, because international travel has been so low, I think that's the beginning of our really good North American winter. Sorry, Paul.
Yeah.
No,
Yeah, no.
glad you said that.
That makes sense. Yeah, I like that. I like that.
What I was going to tell Peter too is that in my general feelings, I think it did contribute. But again, as Oscar Wilde, I always like to quote, "The truth is really pure and never simple." So it's probably multiple factors here, but it is still interesting as you see this happening.
Yeah.
All right. So
And then
go ahead, Peter. Yes.
I have one more comment, and I'm curious to see if anyone's in this. We had a little bit of an outbreak among some unvaccinated fire department members this past week, 5 to be exact. And one of our members who had been vaccinated was in the same room. She had no symptoms, but she asked we have a health and safety chief, and she said, "Hey, I want to get tested." And we tested her just because she had no symptoms, and she was positive. So I called up the Broward County Department of Health, and he said, "Yeah, we've had about 500 breakthrough cases." He said, "But I'll tell you what, test her in 2 days from now, and I guarantee you she's negative." And he says, "I guarantee you that none of her family members will get sick." And lo and behold, yesterday we tested her again. 2 days later, she's negative. Her children, her husband, none of them are sick. And I'm curious I mean, this is an N of 1, but I mean, obviously there must be people on this call who know the ins and outs of transmissibility for those people who actually do end up getting exposed to COVID. And that was some insight that I got. I was hoping to get other people's insight as well.
Well, that goes along with a lot of the concerns in the beginning. At the CDC was saying we don't know if you can have asymptomatic transmission, but pretty much all the data has been going that no, the vaccine, while you might be able to detect some RNA in the airway, it doesn't look like it's very easily transmitted because the viral loads will be low. They'll be covered with antibodies, so it looks like, I mean, I don't know if it blocks it completely, but the viruses definitely do reduce transmission even if somebody tests positive.
So it's great. And we're getting other breakthroughs.
I don't know if John disagrees with me on that. I know John would know more on it.
Yeah, Ken. Peter, you're absolutely correct. If you look at the data from both animal and human models would suggest that the IgG as well as the IgA in vaccinated individuals will actually neutralize the infectivity of the virus. And so the N of 1 probably is a good example of how you can actually identify the virus. But as we said before, very early on in the epidemic, the virus may not be infectious as well. So the inoculum, as well as the infectivity of the virus, is markedly changed with a fully immunized patient.
And John, I appreciate that, and Ken also. But so the other question I have is when you read the AstraZeneca trial and you see how many asymptomatic people ended up PCR positive in that trial, I wonder if this is the same phenomenon where they did find a whole bunch of asymptomatics who ended up doing well. So clearly people are getting COVID, but within a day or two, they're being cleared of COVID with their robust immune system, IgA and IgG. That's what you're saying.
Yeah, Peter, there's a Lancet article that came out yesterday that had a follow-up. You may have seen it in both the Pfizer and AstraZeneca vaccine in UK. If Fiona's still on, she probably knows more, but it's pretty interesting as far as asymptomatic carriage as well. Whether they're infectious, what we don't know is whether those virus, the infectivity hasn't been done in the lab. In other words, we have not been done a lab test on that yet. I'm sure someone's doing it, but I don't know the answer to that question.
Thanks, John.
Okay. So it's interesting, just anecdotally, I have continued to get calls from people. Again, this is all in South Florida, which is interesting, Peter. That's where I'm getting my calls from. I mean, that makes more sense because that's where I'm working. But I am getting other people who've been fully vaccinated and then got sick again, et cetera. So it's, again, is it the 1 in 20 or is it something else, or is it a whatever, you know, that kind of still.
Yeah, I have about 10 people now. I got another phone call this morning about somebody else 6 weeks post-vaccine. But Florida has the most variants in the country, I was told. Broward County has the most variants in the state. So here we go again. Come, you know, just understand that perhaps there's other variants out there, but thankfully we're not seeing any kind of real badness from them at this point in time.
So I have here, we've had from Libya that they had 38 breakthrough cases, but only 1 required hospitalization. And the 38 cases are within the expected range for the number of people that have been vaccinated, meaning I guess the 1 in 20 or whatever it was, unless or more so if you had the Janssen one, okay? So that's kind of interesting, but it sounds like they didn't get as sick. So it is kind of like that phenomenon when you get the flu shot, that doesn't mean you can't get the flu, but you're going to be less apt to be sick from it. So obviously the vaccine is really good, which leads me to, if you guys would indulge me, I'll show you some news stories. You got to see this one from last night. Is it okay if I play another one? This is about a school, a private school, saying that they would let go or not employ people who got the shot because the shot can go on. You got to hear this. This is like another one of these QAnon things where they're spreading around stuff that is like so bizarre. Okay, so if you don't mind, is it okay? We have some time to do that. I'll go ahead and show this. Let's see if I can find it though. I gotta find it. Let's see if I got the. Here we go. I was just struck when I saw this thing, and you'll see Eileen on again, of course. Okay. I can't turn my TV on without seeing her. She's usually on doing something. I think this is the story right here. Let's see how it goes. Can you hear it okay now? Oh, well, you'll see it's going to play in a second. She'd say, until further notice, we may ask employees.
Employee who is not yet taken the experimental COVID-19 injection to wait until the end of the school year. We also recommend that all faculty and staff hold off on taking the injection until there is further research available on whether this experimental drug is impacting unvaccinated individuals. It is our policy, to the extent possible, not to employ anyone who has taken the experimental COVID-19 injection until further information is known. Now, this is it's one thing when you sort of suggest that, you know, a person may not want to take the vaccine, but they seem to be tying employment now to the decision not to get the vaccine, that they're encouraging people not to get the vaccine or it could affect their employment here at the school. Now, we've also been told that so far one teacher has already resigned. It's not clear if it was a direct result of this, but one teacher has stepped down. We know there's a lot of concern among teachers who legitimately want to protect themselves. Now, part of the information that we're getting is that this is the theory. They are promoting, the senators are promoting a debunked theory that says that people who are vaccinated can spread a different type of disease to individuals who stand near them. And so it's a rather bizarre statement, and I'll just read part of it, you know, but it appears that those who have received the injections may be transmitting something from their bodies to those with whom they have come in contact. Now, they cite no scientific evidence. They cite no scientific authority for this. We reached out to Dr. Eileen Marty, who is an infectious disease expert, and she told me just a few minutes ago, I got off the phone with her, she explained to me that this is heartbreaking, that she's actually devastated when we showed her this email, because she says there is no basis in science for any of the misinformation that the school is putting out. She also noted that it's particularly egregious, and that was her word, egregious, that you have a school designed to educate kids promoting this sort of false and misleading information about the vaccine. Now, we're going to have a lot more on this coming up at 6, 7, and 11. We're getting more reaction coming in, but this is one of those things where the school has confirmed that they did send out this email. We asked to have someone appear on camera with us to talk about it. Instead, they sent us an email which basically reiterated all the points that they made in their email to staff and said, we're doing what we think is in the best interest of the children because children shouldn't be around teachers who are vaccinated. So it's a strange story that we're going to continue to follow.
Jim DeFede, I'm sure we'll be hearing much more from you on this topic. Thanks for keeping us up to date.
Very disturbing all the way around, Jim. Thank you for that update. You can now get the Johnson & Johnson single dose vaccine.
All right. So
Paul,
anyway,
Paul, if this was April 1st, I would have thought you were totally bullshitting us. I swear
I
to
know.
God.
It's so bizarre. I know. It's like when I saw this, I want to see if I may have a Eileen shot here. I don't see it here later, where she came on and gave a comment on it. But anyway, hopefully she'll get on with us here in a few minutes. She's at her clinic that was running over. But
Hey, Paul,
yes, go ahead. Yes.
can I talk about vaccinating children?
Yeah.
Yeah. We had a discussion of that this morning since that came out in this. Probably by June, we will have the ability to vaccinate the junior high school age group. So remember, down to age 12. And then probably by the end of the summer, they'll get us down to the age of 6. Those trials are going very well. We ought to think through what we're recommending to our fire EMS services about vaccine clinics that are going to be children-centric, and how different that is going to be, and how we're going to have more kids passing out and having other reactions to the vaccine. And that those are going to be very different than the people who feel that they hit the lottery and are very pleased with getting the vaccine. More people who are not as accepting, and then down to the children that there will need to be. And a lot of discussion amongst the school people now about requiring vaccinations for the children come the fall. So we have some challenges ahead. Thank you.
Yeah, and this just makes it worse when you hear this kind of thing going on. But I was going to see if I can get a Eileen Murdy. Let's see, I'm trying to think. Hey, there we go. Got a quote from her. This is a later broadcast on this one, so here we go.
What she had to say after she reviewed this email.
It's egregious towards anyone who wants to protect themselves from this virus, who would be employed by them. There are no scientific bases for any of the concerns that they raise, and there's no foundation whatsoever. It shows me that the author has a very primitive understanding of what a vaccine is, and really no understanding of the scientific process.
Anyways, that's enough for that.
This is a story that is going to have national implications.
Yeah, and it's already been out nationally, but I want you guys to hear about it because it's just so strange. That's it. But just when we thought we had heard it all, right, then this stuff happened. So it's kind of interesting. All right, so stop share, and I'll get back to you here. Okay, let's see how we're doing. Anybody else have things? Peter says it's an A school, so they must be correct. Sure. All right, hey, so let's get back to some of the folks on the phone, if you don't mind. Or on the call here. Scott Gilmore in St. Louis. We haven't talked about the St. Louis thing. Anything? What's the leading things that you're focusing on now in St. Louis?
So the big thing that I'm focusing on right now is I just received word from my fire chief that we will be returning to semi-normal operations in a couple of weeks, and just preparing for how that's going to affect the department and what exactly he means by semi-normal operations.
Okay, is that like half normal or semi-sweet, bittersweet chocolate or something? So we'll
exactly.
See.
We'll see.
All right. Well, good. Well, thanks. Great to see you. And thanks for your help on that other project we're doing. Really cool, right? So it's really great. So thanks. And we're doing well on the fundraising for Eagles too. So thank you for your great work. This guy is behind the scenes doing a fabulous job for us all, everybody. Someday I want to make sure that's well known. All right, Chuck Mason, how about what's happening in Little Rock? The big Little Rock, right?
Big Little Rock. We have all sorts of things going on today in Little Rock. I've got my 6th director starting here next month, so I'm working my way through them. But we're as far as COVID, we're much like Texas. Our volume of COVID patients is very low. We're about 60 per day. We have plenty of vaccine. We've got it open to everybody that wants it. We have no boarding in our hospitals or hospital issues. We continue to follow ketamine problems closely because we use it fairly heavily. I think the biggest thing that we have going on today that's scary for me is that the governor's is fixing to sign into law allowing the medics to carry guns on ambulances. Well, that's the newest thing in our legislation.
Okay, got it. All right. Well, how do you feel about that, or do you rather not say?
Well, it's scary. It was brought about because of an incident that happened in the state, luckily not with my service, but with another service, where a medic actually defended himself with a gun and was successful in defending himself. But it is something that my medics, half of them, love to do it. We all wear vests. Everybody has a vest, but right now we do not carry guns.
Okay, got it. Well, it goes back to the Jeff Jarvis shots for shots, I guess. So, golly. All right. Well, I hope everything goes okay there. And then anything else then, Chuck? Great to see you and glad to have you on board with us. Okay. So, which is, yeah. So thanks. Let me jump over, I guess, head across and go to Jeff Hayes in Austin. Anything new to report out of Austin, Jeff?
Good morning, Paul and everybody. Nothing really new coming out of Austin. Jeff Jarvis pretty much summed up everything that since we're so close, we're pretty much doing the same thing.
Okay, got it. How are you guys doing? Are you, Jeff and you, guys still working on that paper we were talking about what happened during the ice storm and our suggestions and all that? Are we still doing that?
Yes. Yeah, I sent Jeff most of the data from our stuff, so I think he's been working on it.
Okay, cool. All right, good. Hey,
Yeah, Paul, you can blame Mike Levy. He got a position statement up above this one, but it's still coming.
Okay, got it. No, I get that. So no, that's fine. I just wanted to see if that was that I hadn't missed anything. That's all. All right, good. Let's move over to hey, Laura Hall. I just wanted to say hi. Hey, Laura. So are you still planning to come? Maybe you have something going on in Minnesota, if I remember, or Wisconsin. I can't remember where it was. I thought. Laura, are you there?
Yep, I'm here. Yeah, my granddaughter is graduating, so I'm hoping to be back in time to fly out on Tuesday.
On Tuesday, okay. So you need rooms. I just want to make sure you're covered. Okay, you need rooms for certain nights. Then maybe Tuesday night.
Yeah, for Tuesday night, Wednesday night, Thursday night, and Friday night.
Get out Friday. I don't know if we'll have rooms for Friday night. That's the thing, but I'll at least try to see if I can get you. You want to stay Friday night and out Saturday? Is that what you're thinking?
Yeah, if I can stay on Friday night.
Yeah.
If not, let me know so I can change my flight to come home on Friday.
Yeah, we'll do that. Okay. They're just, the Hard Rock's not being very flexible and give us a certain number of rooms for that night. Okay, good. All right. Hey, RJ.
I understand.
No, I get it. We'll work with you. Don't worry. We're looking forward to have you there. It's going to be fun. Hey, RJ. Let's see. Where was I? RJ, can you give us a report from St. Paul?
Yeah, well, as far as COVID is concerned, we've got about 40% of the state completely vaccinated. About 55% got the first shot.
Wow.
We're short of vaccines, so that's kind of shut down right now. The state is kind of waiting, especially the Twin City area, for the other shoe to drop. We've got 3 other defendants in the Chauvin case that are due for trial in August. We've got the Wright case pending. And so there could still be a hot time in the whole town.
Yeah. Okay. Well, good luck on that. That's all I can say. We'll see how that goes. All right. Well, thanks for reporting in. Are you at home right now? Looks very regal there.
Yeah.
Okay, good.
Yes, I'm home.
Okay. Casa de Frescone. Okay, that's right. That's good. All right. Well, let's move on. Hey, Meg, speaking of Frescone, let's go to Marino. Okay, so Meg, anything you can tell us about New Orleans? Miggy, are you still there? Dr. Marino, besides shot for shots. Are you there, Meg? If not, maybe we lost her. Okay, yeah, you never know what I'm going to pick on you, right? Veer, okay, we'll just jump right back down I-35 there. Veer, anything to report to us from Fort Worth area?
No, things are good. You know, the same thing as all the other Texans here. We are also in the throes of a CEO search. So this will be my second, but we shall see how it goes.
Hey, should I apply? Will they pay me big bucks and all that?
You should apply. You know, I'm actually kind of hoping there's some positions moving. I know that discussion we had on the email chain was really interesting. Interestingly, when we redid our interlocal this year so that I could no longer be an interim, it was almost all but banned so that the medical director could have independence. You also couldn't merge the positions. So it's kind of an interesting way of doing it.
Yeah. Okay. Well, good luck. We'll talk later, maybe. Hey, Ben Launer, tell us about the great city of Baltimore.
The great city of Baltimore. How is everybody doing today? Hello.
Good.
That's good. Hello to all the South Florida colleagues and everybody else. So I think everything has been pretty much steady. The city has been proceeding with vaccinations and partnering with we've really been relying on a lot of the Eagles feedback. There've been quite a bit of collaborations between the city and the health department. So we're vaccinating not only some specific patients at risk, but also helping with some of the vaccines at the stadium. Our call volume, much like everybody else, has been going up back to pre-volume or pre-COVID volume. Before we actually discussed some of the cardiac arrest demographics at a recent Chiefs meeting. And I think, and I appreciate the Eagles response with the previous surveys. We've really been diving a little bit more deeply into a lot of the mobile integrated health initiatives, specifically telephone triage, alternative destination, and transport to urgent care, because we're just having a very difficult time kind of mitigating the volume. So other than that, kind of hanging on in there. So again, it's great to have the sounding board.
Okay, cool. Okay, good. Thank you so much. I hope this has been helpful to you. We've enjoyed having you on this year, so it's good. And then
Absolutely.
I hope, how are you situated okay to be able to return to Broward County in June? Yeah, for our meeting.
So we're still under I'm hoping that we're waiting for another travel advisory. So we're still under the no official travel, which is supposed to be updated like late May.
Okay, got it. All right. Well, let's see how that goes then. That's great. Or you should just, you could just sort of sneak out and do like a risky business thing or something like that. Skip school.
A stealthy Eagles call. I'm sure there's another acronym or something.
Yeah, that's right. Exactly.
Stealthy Seagulls.
So you want to introduce it to Jenny, by the way?
So yep, Jenny's been she's been part and parcel of a lot of our quality assurance initiatives. I know she's been on a couple of calls. She's our deputy medical director, and she's also a pediatric. She's EMPs as well. So
good.
That's great. Doing a lot of we were talking quite a bit about the special populations last time, sharing that PowerPoint. She's been very involved.
Okay, good. All right. Well, thanks a lot. And I don't know if you want to say hi, Jenny, if you want to get on and video yourself in, but if not, that's fine. You too, whatever. So,
well, thank you guys. I'm driving the car right now, so probably video is not the best idea, unless you want to see the roof of my car. But I really appreciate joining you guys when I'm able, and I love the conversation. Thank you.
Yeah, good. All right, fantastic. Well, we got a chow from Dr. Fumagalli, and that may signal the rest of us chowing away, that kind of thing. Anybody, I'll just open up the field to anybody. AJ, I guess I should really grab you if you're still there. AJ Heitman, anything, I guess we might have lost him during that period of time. Is anybody I haven't called on today across the board here? Looks like I think I've got everybody. Anybody else want to pipe in, have anything to report to us or something you thought about later after the fact that you want to talk about?
Actually, Paul, we just hired someone who named Nick Miller, who's replacing Hillary when Hillary left in February. So I'll be introducing him to this illustrious group over the next couple of weeks.
Okay, Nick Miller, right? Okay,
Nick
good.
Miller. Yeah, I'll send her on his CV.
All right, fantastic. So this is good. All right, well, if there's nothing else going on at this point, 10, and then Ken, are you gonna be able to get on the CDC call, and John, is you as well?
I might be able to get on for part of it. I've got two other things at the same time, so I'll probably be switching back and forth.
Okay, good. And Glenn, I hope you can make it as well. So
yes.
I think we got an hour from now.
Yep.
All right. Hey, John, do you want to tell us that things are not going well in India? In fact, the variants are marrying each other and causing bad offspring, correct? Can you tell us what's the latest over there in India?
The Indian, Eileen probably knows a little bit more than I do right now.
Yeah, I was hoping she would get on, but I don't think she got on. Okay, go ahead.
The Indian variant is called B1617, and a couple of the variants have a triple mutation. I'm really concerned about it's affecting the younger population, whether it's just so widespread, we really don't know. So there's a major question about it being very similar to the South African variant and the P1 variant as well. It has very similar mutations, but it's behaving differently as well. well. So we're watching it closely.
Okay, got it. All righty. Well, with all that good news, right? Time to get off, I think. It goes back to me thinking about 1 year ago right now, listening to Mike Osterholm saying, we're in the bottom of the second of the first game of the World Series, right?
Yeah.
So it's going to go on, unfortunately. All right. Well, listen, everybody, thanks again. Welcome back next week to the show that never ends. We'll see you next Tuesday at the same time, same station and all that. And appreciate everything, what you all do. Again, if anybody on the line has got to get their hotel room nailed down, let me know. Okay. And John, I'll call in and make sure you're on the list. Okay. Actually, let me look real quick. I'm just going to double check that you are on the list just in case. I don't have the latest version, but I got a reasonable version. Yeah, you're on there. I got you for, I do think I have oh, maybe not. I think I'm in the wrong Eagles. I'm sorry, I'm on the wrong Excel spreadsheet. So I'll check it out again. So I'll let you know. All right.
Okay. Thanks, Paul.
See you later. Bye-bye.
Bye.
Thanks, Paul.
All right. Goodbye. Good night, everyone, or good day.
Thanks, everybody. See you soon. Thank you.
Goodbye.
Goodbye.
Bye, everybody.
Bye,
Thanks,
all.
Paul.